Hello, friends. In our last episode, we talked about that little click you might hear in your jaw, how it's your joint's way of saying something's wrong inside or moving out of place. But what if one day you wake up and that click just disappears and instead your jaw suddenly refuses to move? That's what we are going to talk about today. When your jaw gets stuck. Let me tell you about one of my patients. She's 29, a school teacher, who called me one morning sounding damn worried. She said, Dr. Mansi, I woke up and my mouth won't open properly. I can't even eat a toast. At first, she thought it was stress. She had been clenching a lot during exam season, so she thought maybe because of that the clicks are occurring. But when she tried to yawn in the morning, her jaw stopped midway. No click, no sound, just pressure near the ear as if some hinge had jammed. And that's when the panic sets in, because when your jaw stops moving, it feels like something's gone terribly wrong. What happened to my patient is something we call a closed lock. Inside your TMJ joint, there's a small cushion or disc that normally moves smoothly with your jaw every time you open or close your mouth. So in the clicking stage, as we have discussed last time, that disc slips out and then pops back in. But in a closed lock, the disc slips forward and stays there. It doesn't pop back in, and because of which there are no clicks. Imagine your lower jawbone, the condyle, trying to slide forward as you open your mouth. But the disc has already moved ahead of it and now acts like a doorstop. So when you try to open wide, the condyle bumps into that disc and cannot go past. That's why you can open only part way, maybe 2 fingers wide. It feels tight, uneven, and painful near the ear. The clicking often disappears because the joint isn't moving freely anymore. So it's not that your jaw is frozen or it cannot recover. It's just that the parts inside are out of sync. For example, imagine a drawer that we are trying to, bring out and it has gone one rail off. It still moves a little but not all the way out. Now, as we have talked about closed lock, it's very important that we talk about another kind of lock also. The open lock. And it feels completely different. Here, the jaw opens too far and then can't close again. So, patient often come and say that my mouth is stuck open and I cannot bite down. With open lock cases, people often come in emergencies because they are not able to close their mouth. The condyle has slipped too far forward beyond the little bony bump that normally keeps it in place. It's like that same drawer being pulled too far out off its track completely. You'll feel your mouth wide open, maybe some muscle spasm and a bit of panic because you literally can't close it. Usually a gentle manual maneuver by a clinician can guide it right back in place quickly and safely. So nothing to worry about. So to make it simple, Closed lock is when your jaw cannot open fully, the disc is stuck ahead of the joint. Open lock is the jaw cannot close, the joint has slipped too far forward. Both are mechanical and usually reversible with early gentle care. But beyond the mechanics, there is fear. Patients often tell me, I stopped smiling. I'm scared it will all happen again. That anxiety can sometimes keep muscles tight even after the joint is fine. So, if you ever feel your jaw getting stuck, don't force it. Apply gentle warmth on the side. Stick to soft foods for a few days and keep your jaw relaxed. Lips together, teeth apart. Then get it evaluated by someone trained in TMJ specific conservative care with mild mobilization, muscle release and posture correction and the use of simple oral appliances. The joint usually finds its rhythm back. No surgery, no irreversible splints. When my patient came back a week later, she was smiling and said, I didn't realize how much tension I had been holding till it all locked up. And that's the truth for many of us. The body whispers for months, and when we don't listen, it finally shouts. So if your jaw feels stuck, pause, breathe. It's your body asking for gentleness, not punishment. In our next episode, we'll explore one of the biggest hidden causes of TMJ pain, clenching and stress, how emotions quietly shape your jaw, and simple ways to let it relax. I am Dr. Mansi and this is TMJ Care. Take care of your jaw. It does more work than you think.